or counseling office.
TMS, do you know anything about TMS?
I just know it's like zapping your brain or it's something like that.
And since I've been having TMS, that has gone away.
Wow.
I could definitely do that. What's your first name?
Brian. Hey, I'm Jake with Rise 4, and today we're going to be doing something a little different. I am going to be calling a mental health clinic in a random part of the country, pretending to be a real patient, just to see what the experience feels like from the very beginning. Everything in this episode is going to be anonymized. The names, headshots, website. The goal here isn't to shame anyone. It's to actually understand what the patient journey really looks like before someone even walks through the door. We'll start by looking at their online presence, and then I'll actually make a call to the clinic. And after that, we'll break down exactly how it went, and maybe even call the clinic back to reveal the experiment. Let's do it. To start, I have here a folded piece of paper, and on here is where in the country we're gonna start looking for this clinic to go ahead and call. Wyoming. Okay, let's go for it. So here we are. We're gonna focus on TMS clinics here in Wyoming. We'll choose this one because they do have a few reviews here. So let's go ahead and take a look. Looks like their Google business profile is not bad. It's pretty good. They have a few reviews here. Let's go ahead and take a look at their website. Okay, this is the website. Yeah, I think there's probably some good SEO value that can be found on the website. Let's go ahead and look at what services they offer. The top, it doesn't, About Us includes the services. Okay, usually you would really want services to be a main menu item here, but I can just see from here they have ketamine assisted psychotherapy and Spravato, as well as TMS, transcranial magnetic stimulation. Okay, overall, if I'm to give online presence a score of 1 to 5, frankly, I would give this maybe a 2 out of 5. It just doesn't really communicate super well with the patient, although the information technically is there. So Google can search it, LLMs can search it. So that's the good news, but the website itself definitely needs to take a much closer look at refining it specifically to what's relevant to the patient, to the person who's actually coming and visiting your website. So yeah, so there we go. Online presence, 2 out of 5. So now let's go ahead and make a call.
Good afternoon. Thank you for calling. This is Maria.
Hi, Maria. I'm just calling to learn a little bit more about TMS and Spravato.
Absolutely. I could definitely do that. What's your first name?
Brian.
Okay, so TMS, do you know anything about TMS?
I just know it's like zapping your brain or it's something like that.
It helps open up new neural pathways, and they use magnets. So it's a really great treatment-resistant option for people that have been taking medications and not getting relief from depression or anxiety.
Okay.
And there's no medication. It's non-invasive. You come in, it's kind of like they put a little hood on your head and hook you up to a little machine that does a little bit of tapping. And then we don't start treatment without bringing you in for a consultation first.
Thank you so much for the information.
You bet. If you decide you'd like to check it out and come in for a consult, just give me a call and we can get you paperwork.
Okay, awesome.
Okay, all right. Thanks for reaching out. I sure appreciate it.
Thank you, Maria. I really appreciate you. Thank you. Wow. Okay. That was really good, actually. I don't know why I'm saying actually. That was really good. So first of all, the next thing that we're gonna rate is responsiveness. And responsiveness, I give it 5 out of 5. That's definitely 5 out of 5 there. I called the number. I don't even know how many times it rang. Or no, it had a phone tree at first, but it was easy to use. She was wonderful. I don't know what you guys think of the call. She took her time. She really explained everything for me. She asked my name, and it wasn't for the purposes of collecting data. It was for the purpose of just talking to me. So Overall, like with empathy, which is one of the 4 metrics here, I would also put 5 out of 5. I think she was wonderful. Call experience, I'm gonna give that a 4 out of 5 just because of the phone tree. But then one last thing is, a lot of this can be really overwhelming for a patient. You hear about TMS, you hear about Spravato. She unloaded a lot of information. It was very useful information. She's very well educated, but it can be really overwhelming for a patient. Sometimes you have to kind of hold their hand through the process and guide them a little bit. I understand it can be kind of pressuring or like salesy, but I like to refer to it as patient advocacy. I think you should take a little responsibility for like, hey, let me get your name, let me get your number, let me become an accountability partner for you through this process. It's not about sales. It's more about, let me make sure that this patient knows, hey, I'm going to be thinking about you after this call. I'm going to want to follow up with you after this call. And I want to support you no matter what your journey is. Whether you go to us, you go somewhere else, it doesn't really matter. I want to advocate for you, for the patient. And that's really what it comes down to. So I would give 4 out of 5 for the phone tree, and then not collecting information for follow-up purposes. This was a great overall experience that I had with Maria, and I'm really excited to call her back to give her this feedback. Now, if I add all these scores together, we have a 2 for online presence, we have a 5 out of 5 for responsiveness, we have a 4 out of 5 for call experience, and 5 out of 5 for empathy. Altogether, what is that? 16 out of 20. So that is their overall score. We can call sort of an initial PX score, patient experience score. So let's go ahead and call Maria back and share this information with her.
Calling. This is Maria.
Hi, Maria.
Yes.
This is Jake. I actually just called you. I just wanted to let you know that I told you my name was Brian. Actually, my name is Jake. This is kind of part of a project that we're doing all about patient experience and just sort of evaluating what the patient experience is, getting information about some of these sort of interventional treatments that people don't really know much about.
Okay.
Yes. I wanted to, first of all, just call you and tell you just what an incredible experience that I had on the phone with you. First of all, sorry, for lying to you, but yeah.
That's okay.
But yeah, no, you were so wonderful to talk to. I just really wanted to kind of go over a few things if you don't mind.
I don't mind at all.
Okay, awesome. Well, first of all, how long have you been doing this?
I have been working for a little over a year.
What's your role over there?
I'm a front admin. Typically, I'm the person that talks to patients as they come in. I love visiting with people, so it's a good fit for me.
So what are your thoughts about TMS treatments, ketamine, and sort of the interventional psych treatments that you guys are providing?
Well, first of all, I just like to say from watching people start, I have people that will come in and they're not even making eye contact. They look down, they don't talk a whole lot, to being bubbly, eye contact, happy. I also have been a patient myself getting TMS because I have tinnitus in my ears, which is like a ringing in my ears. And since I've been having TMS, that has gone away.
Wow.
It's really awesome, some of the things that we offer here, for sure.
Yeah, that's amazing. I mean, it sounds like such a great practice. I'm really impressed overall, and you're doing an incredible job. I just wanted you to know, it's not always easy, especially when you're front desk and you're not as much like actually delivering the treatment, yourself, to have such good knowledge over everything, and you really did. And so overall, I gave your responsiveness a 5 out of 5, your empathy a 5 out of 5. In terms of call experience, I did just have a couple notes. Do you mind if I give just a couple light little notes?
Not at all.
So the first thing is just the phone tree. It was just a little confusing, I guess, just the fact that it mentioned Tamara's name, and you guys have such a huge list of providers on the website. It wasn't super relevant to me as like a brand new patient who was like just now discovering the clinic. And then the other thing was just collecting my information, getting my number, and having the ability to maybe follow up at a later date just to see like, hey, where are you at? What's going on with your journey? Even if I don't end up with the clinic, I could go to a different clinic. It doesn't really matter. Just having someone in your corner who's following up with you and, checking in on you would be my only other note that I had about the entire call.
That is a great note, for sure. And I do that quite a bit of the time. When I was visiting with you, I felt like you wanted time to look over things, and then you would get back with me. I didn't want to be too pussy about getting that information, but I do think that's a really, really good thing, because people love it when you remember them enough to call back.
Well, you were exceptional. I definitely would have called you back for sure. There's no doubt about it. Thank you so much, Maria. I really appreciate your time. And
Sure.
just want to say, thank you for being in this field, and people like you in positions like yours are often overlooked. And I just want to acknowledge you and validate you for the tremendous work that you're doing.
Well, thank you. I really appreciate it. I think you just made my day. I appreciate you calling back.
Well, it's good. So, you deserve to have your day made for sure. So, all right. Thanks, Maria. I really appreciate it.
Have a great rest of your day, Jake.
Okay, you too.
Bye-bye.
Bye. Wow. Well, she was awesome. It was really cool that she let me give her a little bit of feedback. Everybody who does a role like this has a great heart, but there is often this fear of being too salesy because it's this treatment that people aren't too sure about, and I just don't want to be pushy. But even you heard her on the call say, "Oh man, you're totally right. It feels really good for someone to follow up with you." And that's the thing to keep in mind. It's not sales, it's patient advocacy, and we have to push in order for these treatments to become adopted in a meaningful way. So with that said, in terms of a pass or fail that I would give to this clinic, to this overall patient experience, based off of what we reviewed, I would definitely give this a pass. Great work to this clinic, and mainly for hiring someone like Maria, who's done such an incredible job. And thank you so much for watching this episode of Undercover Patient, which is helping clinics to see through the eyes of the people they serve. Thank you.